Hi everyone. We've got some new updates. I know that you've heard about the announcement from the governor, and then we've gotten some emails about changes that are happening here at Willowbrook. So we just wanted to go over specifically how those changes affect us and each of our departments in women's services. So the first thing is that there's changes to the visitation policy, but the good news is that it doesn't really affect us very much. The only big change for us is that there's no more visitors allowed in the OBED. So that was the original plan, and then when we loosened up a little bit, we allowed visitors in, but now they're blocking visitors to ED again. There are some other repercussions for the NICU that Tammy will get to in a minute. And then also, because of the surge in COVID patients, they're having to repurpose some of the OBS rooms and other med-surg rooms to take the COVID overflow patients. And so the OBS floor needs more rooms. And so they're gonna take the third floor postpartum rooms that we have and use those as overflow OBS rooms. So those will no longer be our rooms until this kind of passes and the surge goes away. So we'll keep you posted when that happens. But there's a lot of, that has a lot of repercussions for us. So it's really going to be important for us to work together as a team so that we can manage our throughput and get our patients through the system and not get backed up, because our patients keep coming in to the OBED and coming in labor. And so we need to keep moving them through our departments. There's going to be a push for some early discharge. Some communication has already gone out to physicians about that. So we can talk about that a little bit to come. But I really want to encourage great communication between all the units and really working to find the best place for our patients. I'm going to turn it over to Danielle, who's going to talk a little bit about the repercussions for labor and delivery.
So we already have one surge room set up with 3 stretchers and curtains, so they're set up in a bay style format. It's outside of the OBED, right across from the antepartum break room, and so that can be utilized essentially for whatever we need. If the ER has to start diverting more patients towards us that are pregnant but under our normal gestational age and we get backed up, then it can be utilized for that. If we're having some other baby hold issues, we can use it for that. So it's kind of going to function as a versatile room to be whatever we need at the time. I'm also in the process of converting our old PACU across from OR1 back into 2 bays. Again, that is going to be a functional room to labor a patient, to put couplets in there if we need it, PACU if we need it. Again, it's going to function in whatever capacity we need it to. But those should be up and going by next week, the new one. And then also, we've updated the tip sheet. I created a tip sheet when we were kind of starting to rise with the first event of COVID, and a lot of things have changed since then. A lot of processes, a lot of our PPE recommendations and shared decision-making model has changed. So I collaborated with Sarah Pica and Claudia, and so it's going to be a service-wide tip sheet, so everyone can see what every department is doing. That's why that way it's fully transparent, and so that's going to be coming out today. It's really important that you guys read that just so you stay up to date. I really tried to filter out and only put in the important information, and so it's a really great document to review just so you make sure you are up to date on our processes.
Okay. In the NICU, the visitation is essentially going to be the same. So if the mom or dad is in by 8, they can stay the whole night long. We will still let dads come in 1 time a day, and then moms can come in and out through the day to breastfeed and such. So on the COVID testing with the moms, I know that a lot of staff have been concerned because it seems like there was more and more moms that were not being tested. So how does that impact the NICU stay? If a mom is not COVID tested and she's in labor and delivers a baby that goes to the NICU, she will not, nobody in that family will be able to visit. The option is for mom to be tested, and then she can visit when her test comes back in, and we can do the rapid test for her. Or we can test the baby, in which case it would be a 24-hour test and then a 48-hour test, waiting for that to come back negative before the family could visit. So also, in addition to not being able to visit the baby, if the baby is a boy and needs a circ, we will not be performing a circ unless the baby gets a test and it's resulted by 24 hours. If you have any questions, let me know. TISA's up to date, and we just all need to be on the same page.
Okay, and then Sarah Kika is out for her anniversary today, so I'm going to give the update for the antepartum postpartum unit. The biggest thing that you need to know is that next week we're going to work on getting the dampers changed for all the rooms so that those 9 new antepartum rooms will be negative airflow, in addition to the one that you have that's a negative pressure room. And so this will allow us to have overflow COVID patients that are antepartum or even postpartum to come over onto that unit if we fill up the 4 rooms that we currently have in Old Ante. As we're seeing more and more patients come in, we really have to think outside the box and figure out where we're going to care for these patients and how we're going to care for them. And with this throughput issue, we have to understand that we are just going to fill any available bed we have until it's full. And so we just need to work together and come to some understanding of where the patients are going to go. The other thing is that I wanted to talk about the cohort unit for our COVID patients and some of the PPE clarifications. So I worked with the COVID cohort on the 6th floor to find out what they're doing for PPE, and I talked with infection control and verified with them. So there's a colorful sheet that we can pass out, and essentially those patients are going to fall into the green category of inpatient patients. Primarily these patients are asymptomatic, and so you do not need an N95 when you care for these patients. So you can wear a surgical mask and a face shield, and then your gown when you go in the room. If the patient is symptomatic, if they're getting any nebulizer treatments or breathing treatments, then you're required to have an N95 or a halo PAPR. If you're uncomfortable with just wearing a surgical mask and a face shield, the halo PAPRs are available for your use. But you should not be wearing the N95 really unless the patient is symptomatic. We really need to continue to conserve our PPE because with this surge and increase in patients throughout the whole hospital, we really need to save those for the people that are taking care of the sickest symptomatic patients. But we do want you to feel comfortable and safe and protected, and so that's why we have those halo PAPRs for your use. We're getting some more halo PAPRs, and we should be getting some more smalls and mediums as well. So hopefully that will accommodate most of our staff. We are also getting some reusable gowns soon. We're getting hooks to put outside the door. It should be 3 per room, so that there's a hook for the nurse, for the PCA, and for the physician, so that you can put your reusable gowns on those hooks. And then I want Danielle to talk a little bit about some of the other things that she's put in place for that cohort.
So the cohort unit, outside all of the doors, I put taped black and yellow boxes, and it basically is there to signify a zone for you to safely don and doff your PPE. That way, we're just being mindful of what we're doing, and we're not flinging our arms, and we're close to the nurse's station. Not that anyone would do that anyways, but it's just another reminder to help keep our area as not contaminated as we can. The doors outside of 41 and 40 in between them, the electrician is coming today, so those should be able to pop open just by the button on the wall. And so that way we can block any unnecessary traffic from coming in, but we can still get to the OR in an emergency situation. I've placed signs on all the doors entering that cohorted unit, so that way everyone should be aware that it's a high-risk area. We will have more information to come out about the reusable gowns. That way there's no confusion on how to use them. I think there's been a little bit of confusion on the cleaning process for the shields. So there is a bin over there that's in a blue bag now, and it's labeled blue cloths only. When you come out of the room, you clean the shield with Virex and a blue wipe, and the blue wipe is only to be used one time. It's a one-time use. I've seen a lot of it being on the counter or being used multiple times, and so you're just recontaminating your shield every time. So it's a one-time use, and please, when the bin gets half full, just go ahead and let EVS know, so that way we can keep the laundering process going and we're not in a position where we don't have any of those blue gowns, or blue cloths. I think that was, one other thing, for the N95s, please don't hang your N95 open on an IV pole. I saw that a couple times this week, and it's just risking other people exposure, touching it on accident. Brown bags are the recommended storage for the N95 because you want them to dry out. However, there is an issue with getting the brown bags, so in the meantime we do have the clear Ziploc bags. So the recommendation is to have it, you can poke a hole through the bag, hang it on the IV pole, then leave it open, and you can put your N95 in there labeled. Or if there's a spot right by the patient door, some of those have like cubby areas, you can put it in the bag and have it by the door. Please don't put it at the nurse's station or where high traffic areas are, where other people are, just because we want to be mindful of our contamination. So I think that's basically.
We're going to try and also get a backpack of N95s for the antepartum unit specifically. So if you are an employee that reports to Serapica and you need an N95, you'll be able to go over to the antepartum unit and log out your N95 over there. And she'll develop the same type of tracking that we've got in L&D right now. And so that way we can just keep track of who's got an N95 and how you're repurposing them. Okay, now we're on to Claudia and Mother Baby.
Okay. So for Mother Baby, the visitation remains the same. So even though there's a change in the policy hospital-wide, we still do get one essential visitor to the room. And if we do have a COVID positive patient on isolation, the visitor can leave the room, but they can't wander around the entire hospital. So we do need to educate them and to make sure that they're not walking all over the place. They just need to get to and from their destination where they need to go. The other thing is that we do definitely need to focus on our throughput. So most patients, they will be looking at a 24-hour discharge. We really have to make sure that we are helping each other to get through that. So once the OB and the PD has evaluated the patients and they have deemed that they can go at 24 hours, those orders go in. We really must make sure that we get that the discharge started. So discharge begins at admission. So once the patients are admitted, we really have to get that going with doing the discharge checklist, making sure the patient has that. Address the birth certificate paperwork, make sure that's filed with the birth registrar, making sure that you follow that up shift by shift and that's passed on in handoff, making sure that each nurse at handoff is addressing all the milestones that the patients need to get through to get to discharge. Addressing all the screens with the patients, so the hearing screen, the heart screen, all the vaccines that need to be given, making sure that those are done. Car seat challenge, if baby needs a car seat challenge on admission, please make sure that you are making sure that the visitor will go get the car seat and have it here already. So we're not trying to get that at discharge, because then that will definitely hold the discharge up. For circumcisions, making sure that that's already set with the pediatrician, because they will try to do the circumcision starting at the 12-hour mark. They can do that, and if there are any opportunities to do that, then they'll do it so their discharge circumcisions won't be done. And then just making sure that discharge education gets started on admission, and then follow through every 6 hours at least. So every shift, you are looking at what milestone have they met in their education, and so that on the day of discharge, we're not overwhelming the patient with all the information for discharge. So by the time they're going out the door, it's just let me check in, let's see what we did we miss anything, and so that everybody's they're good and ready to go. So please make sure that so we are good and ready. So by 24 hours, we should be able to move our patient through safely and ready. What we'll be doing is checking for orders that day of discharge. We will be working through baby orders and mom orders. So every 2 hours, so 8 o'clock in the morning, we'll be checking how many orders we have and what are the barriers that we have for the discharges. And then going every 2 hours, checking what barriers we have and how we can work through them. As soon as a barrier pop up for a discharge, please escalate that, and then let us work through it. And that's the best way that we can do it, and so we can work through and get our throughput going. So please help us to do that. We appreciate it.
We do really appreciate it.
Thank you.
This is going to be hard for all of us,
Yeah.
and it's going to be a learning experience, and we're all going to figure out how we're going to get our patients in and still give them the same quality care that we've always given them, and just try and figure out the best place for our patients to go, and try and maintain some open beds for those emergencies that just walk in that we need to have. So I just really wanted to stress again communication between the departments, and if we have to add another shift huddle with the charge nurses during the shift, then that's
Yeah.
something that we might want to think about. And also, really, if you guys are sick, if you're not feeling well, please do not come to work. Please call your charge nurse, let them know, set up a virtual visit, and get an order for testing. We really want you to be safe, and we don't want you to expose any of your other coworkers or our patients. So we really want to look out for your health and your safety, and we want you to take care of yourself. So if you're running into any issues or if you have any concerns, please let any one of us know, and we can kind of address that. If you have any questions about this, please let us know. Please send us an email or a text or a phone call, and we're happy to answer any questions. You guys have anything else? Okay.
All right, thank you guys.
Thank you.
Bye.
Bye-bye.
Thank you.